Welcome to the Enspiring Perspectives podcast, where meaningful conversations lead to meaningful change. Presented by Enspire Consulting Group, this podcast explores the intersection of education, mental health, leadership, and community through honest conversations with experts, practitioners, and changemakers. Whether you're an educator, clinician, parent, leader, or simply passionate about making a difference, each episode is designed to provide practical insights, thoughtful discussion, and perspectives that inform, empower, and inspire. Making a difference is what drives us to create change in our communities. Because every perspective has the power to create change. Now, here's your host, Dr. Frank Edwards.
Welcome back to Inspiring Perspectives. I'm your host, Dr. Frank Edwards. Last episode, I shared my journey and why I started Enspire Consulting Group. Today, I'll be talking about something I've witnessed thousands of times throughout my career as a school psychologist, as a therapist, and as a business owner. And that is good kids, kids with huge hearts, kids with incredible potential, kids who desperately want to succeed, yet somehow they're labeled as lazy, disrespectful, difficult, defiant, disruptive, even dangerous. But what if we've been asking the wrong questions, right? Instead of asking what's wrong with the child, maybe we should ask, what is the child trying to tell us? Again, maybe we should ask, what is the child trying to tell us? And so what we're going to explore today is why we judge behavior instead of understanding it. So as we discuss today, we're going to explore why we judge behaviors instead of understanding.
Okay, so the first question we have is, why do you think adults are so quick to label children?
And so, by the way, guys, behind the scenes is my assistant, who is the guru of technology. She helps with all of these things. So welcome, Zakira, to the chat.
Hi, nice to meet you guys.
All right. So again, the question is, why do we think adults are so quick to label children? All right. And that's something that we can kind of explore and you guys can think about. But human beings judge what they can see oftentimes, right? I'm guilty of that. I'm sure you are. Behavior is visible. Like you can see it. However, the underlying things like anxiety is not. Trauma is not something that's visible. ADHD is not visible. Autism, oftentimes, with the trained eye can be, but oftentimes is not. Depression isn't. Learning disabilities are definitely not. So we oftentimes suspend behaviors, but we don't suspend anxiety. We don't suspend ADHD. We don't suspend things like that. So, along those lines, what we're going to talk about in the story that I want to kind of jump into is one day I was sent a referral for a student, and the referral was because the student was labeled dangerous, unsafe, and presenting behaviors that are not appropriate for a school. And so I'm walking into the meeting and I'm ready to kind of see this angry child that, they've tried a bunch of strategies to support the child. The child has gone through many conversations with adults trying to understand. And honestly, that wasn't the case. So I walk into the meeting. There's this young man who was 10 years old, I want to say. Parents were sitting at the meeting, principal, sped director, teachers, all of these adults were sitting at this meeting with this young man. The young man had his hands crossed, face frowned up, while the adults were staring at him as in disbelief. So I walk into the room, not knowing what's going on, except for what I was told via written communication. First thing I do is I come in, I see the child, see his posture, and I ask, in a very respectful way, if the adults can excuse themselves for 5 or 10 minutes so I can have a conversation with this young man just to get a baseline, just to get an understanding as to his perspective before we continue this meeting. So the adults, they leave out. They leave out the room. Me and the young man begin to talk, and, he wasn't as welcoming as we began that conversation. So I began to ask, so what did the adults do to make you behave this way? Right? And I changed the tone of, instead of it being his fault, I put it on the adults in the room. And he immediately opened up and said, the adults and my mom and my dad, they don't understand. They're going through a divorce and it is my fault, but I don't know, and they're not talking to me, and they're trying to hide it, but I know what's going on because my dad no longer lives in the house. My mom is oftentimes telling me, don't say this, don't say that, specifically when it comes to spending time with my dad or, wanting my dad to be in the house. And so I said, did you talk about this with anyone else besides what we're doing today? And the young man said, no one has asked what's wrong. They've all just told me what's wrong and what I'm doing wrong. And so from that conversation, it gleamed that this young man definitely needed some support, and the adults in the room needed to be addressed before this could be addressed, and to put this situation or this problem on the child. And so I called the adults back in. I asked that the meeting be reconvened in about 2 weeks. And during that time, I recommended that the parents, as well as the child, seek outside support through a therapist if they didn't already have one. But they can also talk to the school counselor about, some of the behaviors that are being seen, but some of the issues that may be going on that has not been discussed, and that the child should be involved in this more so from a family perspective. And so fast forward 2 weeks later, we convene back, and what happened is this young man, we didn't see these behaviors anymore, right? They didn't totally disappear, but his quick to anger was gone. Reports was he was, yelling at students or yelling at his classmates or, throwing things when he got upset. Those things had decreased, almost disappeared, right? And so now the question is, do we need to give this child a label? Do we need to assess this child? And at that moment, I said, it sounds like we're moving in the right direction, and there is no need to label this child. Parents were in agreement, school was in agreement, and we continued to move forward. And so, in a couple of weeks, I'll check back with them. But that's my story. And that's centered around what we're talking about today is, why are we labeling children instead of trying to understand them and things like that? So for you, audience, how many children are walking around carrying labels instead of answers? And so I challenge you to think about that. Ask yourself that. If you have children and they are struggling behaviorally, right? Talk to them. Find out answers. Ask those difficult questions to try to understand the root cause of the behaviors instead of just merely giving labels. As we continue the conversation surrounding behavior, it is, what is behavior really communicating? And so we'll focus on behavior is communication. All right. And again, the question that I would pose to you is, what is behavior really communicating? As most of you may know, but children oftentimes communicate through behavior before they actually communicate through words. Sometimes their behaviors demonstrate that they are overwhelmed. Sometimes their behaviors suggest that they're embarrassed, depending on the situation. And sometimes we may not even know if we embarrass children nowadays. There may be because they are afraid, right? They're experiencing something and they don't know how to deal with it. And so they act out. Sometimes truly, they just don't understand, or they're trying, or, they continually trying. And at that point, they're acting out, right? Because then they've given up, right? And so some of the things that we oftentimes see as a psychologist, we look at different behaviors. So it's fight, flight, freeze, and fawn. So again, what is fight? What is flight? What is freeze and what is fawn? And so when we're talking about catchwords or words similar to that in relation to behavior, fight is an example is a student in a classroom with the teacher. The teacher is asking them to do something, and they're going back and forth with the teacher, just not going along with the program, right? Flight. What is flight? Flight can be considered, it's an uncomfortable situation, and that student is going to avoid or get away from it. So in the classroom, it could be a student is asked to read aloud. They know that they're struggling with reading, and so they avoid and do everything possible not to read. And that could be they're acting out, they're creating a diversion and something like that. Freeze is an example of that is when a child is just there's a lot going on and they just stand still. They don't move. They don't react or act. It could be a situation where your son or daughter is involved in school and a bully or someone is bothering them and they are that afraid that they are just stuck. They're frozen. They don't say anything, they don't do anything, and they wait for it to pass almost. And then, they unfreeze, if you will. And so those are some of the things. Fawn is one of those things. What do you think, Zakira? What do you think about the term fawn?
So fawn could be like in a home situation where a parent and a child doesn't agree on something. And then a parent could not want to discipline their child in order to keep their relationship, favorable, or a child can not express what they're feeling for the same reason.
Can you define a little more?
It's kind of like trying to appease a situation in order to avoid a difficult or like a scary situation.
Okay. All right. Great. So those are some examples of behaviors and or things that we may see in children. And again, for example, a teacher calls on a student. And how often do we see that? A student starts clowning around in the classroom after hearing that from the teacher. And then the teacher automatically thinks like this student is attention seeking. But in actuality, it's not that they're attention seeking. It's that person may not be able to read. And so that is their way of avoiding or flight, if you will, right? So a powerful quote that comes to mind as we begin to talk about this topic is children don't always have the vocabulary to explain their pain, so they act it out, right? So that's powerful. Children don't always have the vocabulary to explain their pain, so they act it out. And as we conclude this part of the conversation, I want the audience to continue to kind of think about what are you seeing at home? What are you seeing at schools? What are you seeing at your churches, your synagogues, your mosques, your all of these places? What are you seeing from the children that you are around? And then I challenge you to look beyond what you see to then try to understand. What is the root cause? Why are these behaviors happening? This is Dr. Edwards, and this is Inspiring Perspectives.
Thank you for watching the Inspiring Perspectives podcast, brought to you by Enspire Consulting Group. Follow us for more conversations that empower individuals, strengthen families, and support communities. Until next time, take care and remember to keep inspiring positive change.